All right, my name is Brandon Johnson, and we're talking about men's health, specifically PrEP. So I'm a health educator here at GNR, and today when we talk about PrEP, we had to go get the experts. So I'm going to allow everyone to introduce themselves. Phyllis, Jamie, Dorian, Jonathan, and She. Introduce yourselves and give like a brief intro.
My name's Jonathan.
All right, Jonathan, you're first.
All right, my name is Jonathan Davis, and appreciate you guys having me. Next.
All right, next.
Hi, I'm Amy Colson, and I'm kind of new to PrEP. I've only been doing it a few months. And I'm working out of Buford right now, just doing COVID vaccines.
Okay. All right, Jamie.
Hi, my name's Jamie. I'm 22. I've been doing PrEP for about, I don't know. It's been some months, but I've been doing it for a while. And
Okay.
yeah.
All right, She. Is that how you pronounce your name?
This is Shu. Hi. Sorry, I'm actually commuting too, but I've been doing this probably with PrEP. Wow, it's been quite a few years. Start with Truvada and then Discovy, so it's been at least 5 to 6 years for me.
Okay. All right, Dorian.
Good afternoon, everyone. My name is Dorian Freeman, and I am the Clinical Infectious Disease Program Director with the Gwinnett Newton and Rockdale County Health Department.
All right, awesome. And Phyllis?
Good afternoon, everyone. I am Phyllis Mwaura. I'm the PrEP coordinator for Gwinnett, Newton, and Rockdale Health Departments, and thank you for joining us today.
Perfect. All right, 3 things that we want to talk about today with PrEP is the stigma, the cost, and the clinical aspect. Because we want to give people the most valid information out there. So basically, when we talk about the stigma, it's a stigma around PrEP where that kind of gives people that need it a hesitancy to actually go get it. So we want to jump right in it. And I want to ask the panelists a question. The first question is, do you think PrEP is only for sluts? Jamie, you on mute. You guys can unmute your mics.
Oh, I didn't know that was for me.
I saw you talking.
No, I don't think it's for like sluts per se. If you are sexually active, I think it's a good thing to be on, just to have further protection for yourself and then further protection for who you're having sex with, just to lower anything that can possibly go around. But I don't think it makes you a slut or anything if you're on it.
Okay. Jonathan?
Most definitely. No, like he said, I mean, I agree. It's just to stop the infection from spreading around. That way, get it under control. Maybe, hopefully, it'll eventually be obsolete.
Awesome. Shu?
For me, it is not just for sluts, but like everybody has said, anything, like anyone that has been sexually active, whether you're sexually active by choice or it's because your nature of work, is an extra protection, like extra layer of protection for you, as well as for your partner.
Perfect. Yeah, that's what we're trying to get people to understand. Like people they shy away from the drug, even though they may need it, just because of the stigma. And if we get people who are actually using the drug and see them using it in their everyday life, then we kind of eliminate that stigma. Another question for the panelists and Phyllis. A lot of people think, since I'm on PrEP and I don't need PrEP if I'm in a committed relationship. Do you guys think that's a true myth or false?
That's false.
Right.
Exactly.
I would say false.
Can't trust a man.
Right. You only know where you are 100% of the time.
We're all
That's what my coworkers say.
All made from the same cloth.
I mean, definitely false. It's either you're on it or both of you are on it. Either way, protect each other. So Do it.
And you about to say something, Jamie?
Oh no, I'm nervous.
No, don't be nice. Okay, anything you guys, Dorian, Phyllis, anything you want to add to that?
I can chime in. Surely, to answer this question, really, let's remind ourselves about the goal of PrEP. Pretty much the goal of PrEP is to prevent HIV negative persons from getting HIV infected. And there are many things to consider before concluding if you need PrEP or not. The main question to ask yourself is, am I in a mutually monogamous relationship with a recently HIV negative tested partner? If the answer is no, or if you're not sure, then consider PrEP. Having said this, the question really to ask ourselves is PrEP right for me? Or who can benefit from PrEP? So PrEP is for people who are at risk of HIV acquisition from sex or injection drug use. PrEP is also beneficial for someone who has a sexual partner with HIV, especially if the partner is viral load is unknown or detectable. If you do not consistently use a condom, then PrEP will be beneficial. If you have been diagnosed with an STD in the last 6 months, then you need to consider PrEP. If you have been prescribed PEP, also known as pre-exposure, post-exposure prophylaxis, and you report continued risk behavior or you have multiple causes of PEP, then you need to think about PrEP. If you inject drugs and you have an injection partner with HIV, or you share needles, syringes, or have other equipments that you share, in the process of drug injecting, then PrEP will definitely be a good option for you. Thank you.
Awesome. And a lot of people don't even know their risk. So by us here educating people and letting them know the actual risk, oh, I might need it, and educate them about PrEP. So it's glad all you guys are here to actually let people know the risk and who was a good candidate for PrEP. Like you say, is PrEP for me or for whoever needs it. So I think that's awesome. And my last question is, true or false? Is PrEP only for gay men?
Are
Nope.
very, very false.
All
I
right.
didn't know.
Why do you think that stigma exists, or what do you think we can do to break that stigma? Because a lot of people out here, like she just named off a list, and probably nobody was gay men on that list. So it's a lot of people that need it and aren't getting it, and that stigma kind of draws them back. So what do you think people can do to break that stigma?
Definitely spread awareness about it. Because like sex isn't the only way that you can get HIV or anything. And I feel like within our community, I feel like because it's a very broad community and because we are looked down upon, that's the first thing that everybody's going to go to. But I feel like if you try to raise awareness for it and you try to let people know about the ways that you can catch it, it would open a lot more eyes. As far as like needles and everything else, because that's probably one of the main things to catch it before sex anyway.
Right. Dorian, Phyllis, you guys want to add anything?
I'll add, and that's so important in what Jamie stated. That's so correct, Jamie, that, we need to make sure that awareness is out in the community. And definitely, that's something that we find that's going to be instrumental if we're going to reduce the number of HIV cases. And like Phyllis mentioned, and Brandon mentioned, most people don't know they're at risk. If an individual's had sex without a condom with a partner, you don't know their status, then you're at risk. And if you ask a lot of people, have you had sex without a condom, or maybe you didn't use it, maybe it was just one time, or you only use condoms sometimes, then those individuals are at risk if you don't know the status of the person that you're having sex with, or if you don't know, like Jamie said, in regards to IV drug use, if you don't know if that person's HIV negative, then there's that risk. So definitely, like you said, it's just not, PrEP is not just for gay men, but for anyone who meets that criteria or who engages in any type of risky behavior, PrEP is for them. And it's just like Jamie said, it's educating the community and bringing that awareness so people are educated about PrEP. They know that that's an option, and they know if PrEP, and making it accessible for those individuals also.
Right. That's a good point. I mean, people go from relationship to relationship, and it would be all ideal if you met a person and first thing you do is go get tested on your first date, but that's not happening. So you go through 3 relationships, you're at risk. So it's for everybody who's at risk.
And people lie too.
And Brandon,
people lie.
Right, exactly. So
One
yeah,
that one
right.
lie, whole life. That's all I gotta say.
Right. Exactly.
And sometimes you have to even think about like if you're going to get a tattoo or something, they make you sign stuff just because there's going to be blood in the process of anything, and then there's cross-contamination. And now we're in a time of the pandemic too, so it's like you really have to take those measures because everything is going into those factors. So you just got to protect yourself.
Right, exactly. Good answer.
I have tattoos and I can attest to that. Yep, I was asked to sign a waiver of some sort, and basically, anything happened in terms of that is not their fault really. But I'm sure they sanitize most of the stuff from like a stigma standpoint. A lot of times, when you talk to other people, like how many times were you asked? Whether they don't ask you really what your status is, but they ask you, are you clean? I'm just kind of try to use that segue to educate, as in, hey, instead of asking whether you're negative, positive, undetectable, whatever case would be, why don't I ask, hey, when was the last time you get tested? A lot of times they're able to tell you, hey, maybe a month ago, maybe 3 months ago, or they can't answer their question.
Maybe
that probably brought you a pretty good red flags and stuff like that. And maybe use that conversation like kind of the segue into, hey, have you heard of PrEP, or are you on PrEP? Like kind of like an open-ended question instead of just, oh, are you clean? Yes, I took a shower today. Thanks for asking anyway. Kind of thing.
Right. Yeah, that's a good point. All right. The next topic is cost. A lot of people scared of PrEP because they think it's too expensive. What do you guys experience with? Do you guys think PrEP is too expensive?
I can attest to that based on your insurance policy. Without insurance, yes, it could be expensive. I know, your manufacturer, Gilead, do offer some kind of financial assistance, but sometimes they might not cover everything. And of course, it depends on what your individual insurance that you have, whatever they cover.
Okay. What about you, Jonathan?
Well, I mean, I get it for that discount price, but but I was gonna say no, it's not too expensive. I mean, because you guys, or Gwinnett County offers the prevention program. That's why we're all here. Is to, I guess, promote that. So there is options out there, and there is financial assistance for those who need it to make it very affordable. And you can ask Phyllis. I mean, I've had several people, friends of mine, that I've helped get into the program, and thanks to Phyllis, she got them all signed up and everything, and everybody's good to go with that. So she's awesome.
All right, good job, Phyllis. What about you, Jamie?
It's actually free for me. I first found out about PrEP through school at GGC. They were doing like HIV testing and everything. And the lady actually told me about PrEP, and then that's when I went to the clinic, and they pretty much got me educated and told me about it and got me started.
Right. So yeah, that's a good topic to go over, because a lot of people won't get into stuff because I won't go look at a Maybach because I know I can afford it. So when people are like, oh, that I actually can afford it and this is obtainable to me, then they will actually, you can debunk that myth, and they can actually take the first step to actually looking into PrEP, because they feel like they don't have insurance, which is my next question, Phyllis. Is PrEP for people only with insurance?
No.
You said that quick, no.
More beneficial to those who don't.
There are other
a lot of
options. You
people
might
think
have to
that.
jump
A
through
lot
a
of people
little bit
think
more
I don't have
hoops,
insurance, I
but
can't get it. I'm sorry.
like I'm sure there are other financial assistance options, and I'm sure there are hoops you might have to jump through.
Uh-huh.
But like there are other co-pay assistance program out there, kind of thing. It just depends on your provider, like how like some of the providers, like when you ask them about PrEP, they kind of look at you like, what is it? Like some of the providers
Right.
don't even know that exists. Like that's the problem. Like if people that are within the industry that doesn't know, how do you expect an average consumer out there to know?
Yeah, that's one of our goal is providing education also. So they can start putting it in front of people, educating them on how to actually present PrEP.
Yeah, like the people I brought to Phyllis to, get them signed up, they had no idea what it was. I was
Yeah.
like,
Yeah, didn't know it existed. Right. Phyllis, you want to add anything?
That's an important point. And Shu, I'm glad you mentioned that because we recognize that not only does individuals in the community, are they not really aware, are the people who are eligible for PrEP or who should consider PrEP, there are providers who don't know about PrEP. So I'm glad you stated that, because that's one thing we're really trying to focus on is really engaging our providers, engaging them about making sure they're taking sexual health histories when people do encounter the healthcare system and they're going to the doctor. There are many people who say they go to doctors' offices and they're not even asked about their sexual behaviors or if they have any type of drug use history to identify if they even need to be tested for HIV, but also educating about PrEP. So that's very important, and a very important point that we need to educate and make sure the providers are educated so that they can educate the population that's coming into the clinics and the doctor's offices. So great point.
Yeah, I know. I seen in my file high risk sexual behavior. I was like, that's a syndrome.
Just to chime in into what the panelists have mentioned and Dorian as well, at GNR Health Department, we serve all the patients in our community with or without insurance. So what we do is for our PrEP patients, we enroll them in Gilead Advancing Access Program for getting the medications. We also utilize the federal 340 Part B for drugs to pay for medications. So pretty much let the word go out there that we serve all the patients in our community with or without insurance. Just bring them to us and we'll take care of them.
Yep, drop them off with Phyllis.
All right. I know it from experience with providers, they don't, like they'll see a ring on your finger, like, oh, you married, anything you're worried about? If you say no, that's it. So they don't know what you're going to go do when you walk out the door. So they don't care. They go sleep like a baby, no matter what. So it's up to us to educate the providers and the public about the need and the availability of PrEP. And another question I'm going to ask you, the panelists, then I'm going to come back and ask Phyllis and Dorian, kind of get the clinical side. So how long does it from your first appointment to actually receiving your medicine? What's that process like? I'll start. Go, Jamie.
Let me see. So I would say it was about at least a week, before like my first meeting, before I went to get my first prescription. Because they make it pretty quickly. Like after that first appointment, I know everything is usually sent out, and then they ask if you wanted to get like delivered to you or if you wanted to come and pick it up. So yeah, it was like I would say at least within a week to 2 weeks, but pretty quickly.
Okay. What about you, Jonathan?
I'd say the same, about a week. There was a little bit of mix up with one of my tests. Just it was, nobody's fault in particular, but after that, like I said, it was about I'd say less than a week. We were good to go.
Perfect.
So quick. And I have some people that I actually took to like to Phyllis, they got started. I guess now they're actually leaving the same day with it. So
that's good.
versus from when I started. I mean, I've only been on it for about 8 months. I forgot to mention that at the beginning. I'm sorry.
It'll come up. And Shu, how about you?
Mine took about a week or two when I started because of insurance purposes. They have to approve stuff, and then they're like, "Well, you can't get it retail; it has to be shipped to you." Like as far as like from a blood test standpoint, everything went fine, but when getting the actual medication, it took like a week or two because all the insurance mixed up, and then there's like a specific way that Caremark wants to do it, so that took a little bit, but it is fairly quickly processed, and that point of time Phyllis did keep me very informed, so I should be good.
Perfect. Okay. So we got the panelists. So Phyllis and Dorian on your clinical side, behind the scenes. What's going on back there?
Well, we are now offering same-day PrEP, meaning, when you leave the clinician office, prescription will be sent to the pharmacy. Same day, the pharmacy will contact the patient within a day or two, to get your medications. So the tricky part is when the patient is given a call by the pharmacy, if you answer immediately, then because they need to clarify your address, your best way to send the medications, they need to enroll you for the patient assistance program. So if you don't answer the call, then medications will not be sent. But immediately if a patient answers the call, then all that is taken care of, and within less than a week, you have your prescription with you. And usually for us, there are 4 ways for our patients to get their medications. You can get it through UPS delivery at no extra cost to you. You can also get it through courier services, or you can choose to pick the medications from our local health center, or just pick up from the pharmacy, which we use Decatur location pharmacy or Duluth pharmacy.
Perfect. Anything you want to add, Dorian?
Only thing I add is, like Phyllis said, I mean, we've really been trying to streamline our process. And the most important thing is making sure that we're able to get the prescriptions in the hands of the individuals as quickly as possible. And I think, Positive Impact has done a great job and are really working really hard and making sure that all patients have quick options to get their medications. Like Phyllis said, whether you're picking that up from the health center or getting that mailed to your home, we've really worked really hard. And also, I know initially we used to have you come into the clinics, get your lab results, wait about a week or so before you get your lab results, come back in a week to review your lab results, and then your prescription was sent. So I definitely think, we're making progress, and based on the panelists stating that they were able to get their prescriptions in a week. I know Shu said his took 1 or 2 weeks, but that definitely sounds like progress in ensuring that we're getting those prescriptions out quickly. But definitely, if you all, the panelists, feel like, it's taking a little bit longer than what you want or expect, definitely let us know that, because we're definitely always looking to improve that process.
Also to add on that, for patients who do not have, whose the insurance is mandatory mail order to a certain pharmacy, like, for example, the Shu experience, we try as much as we can to work with that insurance and those pharmacies to make sure that our patients get their medications within 7 days from their last HIV test at least.
Awesome. See, so now from appointment to actually getting the pill in your mouth is about a week, and that's amazing for a drug that can save your life. So another thing the last time I want to get to is the clinical aspect of it. So the actual, what it's like to actually be on PrEP. So we done talked about the stigma and the cost, but now you got the pill, now you want to know what it's like. So how long have you guys actually been on PrEP? And like, it's a stigma that I can't take it too long. So like, how long have you been on it? Has you had side effects? How's your experience been?
Like I said,
oh, you can go down.
Well, I've been on about like 8 months, like I said, and the way I look at it, the only side effect I had was I had a very mild headache for about maybe a week and a half. But HIV or mild headache, I'll take the headache. You know what I mean? It's like, so mean, that's a no-brainer there for me at least. But because the mentality of it's very different these days since it's treatable. But I mean, I don't care if it's treatable or not. That's not a life I want to have to live. Personally. I mean, no pun or anything against the ones that do have it. 'Cause I mean, most of them, I'm sure they can't help it, but there's wrong circumstances or wrong place, wrong time kind of thing.
Yeah, if you're able to prevent it.
Most definitely. So I'm saying if we can all just pull together, maybe we can make it obsolete. So
right. Shoot.
I've been on it since like when I moved back to Chicago. So it's like at least 5 to 6 years for me. I remember when I first started, it was Truvada, so it's a bigger blue pill versus the tiny one, the Discovery. When I first checking it, maybe a little tummy issues, but as long as she have food prior to taking it now, those symptoms kind of subside. And like Jonathan said, if you ask me, minor tummy aches or HIV, pretty obvious answers. So other than that, yeah, not major side effects, but obviously got to get your blood work check every 3 months, make sure keep up with all that.
All right, Jamie.
I had I've been on it. I don't know. I think I want to say 3 months. But the only thing I would probably say is like the headache, just like Jonathan said. It wasn't as long. I think I had took like an ibuprofen or something to calm it because it was like really, really bad. But after that, it pretty much went away, and then everything seemed pretty normal.
Okay, that's awesome. All right, this question's for you, Dorian. Are there any scientific studies, any research with long-term use of PrEP? Like, is it harmful? What do we know about the long-term use of PrEP?
So the most important thing with PrEP is, and many of the panelists can attest to it, that we really are careful in ensuring that we're keeping an eye on the kidney functions, ensuring that that individuals, when they're going on to PrEP, that we're ruling out any type of liver complications such as hepatitis A, B, or C. So when individuals come in for that first appointment, those are labs when we draw blood that we are checking to make sure that those individuals up front are healthy or don't have any medical conditions that they're not aware of that could potentially be problematic with them taking PrEP. So we rule that out when they come in for that first appointment. We're also taking a detailed history with those individuals just to see if there's even a past history of any kidney problems, of any problems with the liver. I know there's been some discussion in regards to like Truvada, as far as if individuals have history of osteoporosis, which is like significant bone loss. So we're asking those questions and ruling that out. But with Descovy, they found that it doesn't so much significantly increase the risk of bone loss. So that's the most important thing as a clinician. So when you're seeing that provider, that we're asking those questions. And if we're ruling those things out, like I said, the hepatitis, kidney problems, liver problems, problems with bone loss, when we're ruling those things out, then when we identify those individuals, of course, we will refer them before starting them on PrEP. But for individuals who deny any history, then PrEP is safe for them. And we continue to check those kidney functions with the blood work and ensure, and as long as someone's on PrEP, that is safe for them to stay on PrEP. And as long as there's a risk identified, and we usually try to assess that yearly to evaluate if someone still needs to be on PrEP, what their sexual behaviors are, what their drug use history is. But as long as someone feels that they're at risk and the nurse or the practitioner identifies that that person's still at risk and that we think PrEP is the best option to provide that protection for them, then PrEP is safe to stay on indefinitely. Because most importantly, we want to make sure that we don't have someone convert or put someone at risk when it's an infection or HIV that we could have prevented. So like I said, definitely you can stay on PrEP as long as, you know, your kidneys and all of that are looking good.
Awesome. And another question I have for the panelists, you guys are on PrEP, you know what it's like. A lot of people who aren't on PrEP may read this potential side effects and say, oh, it'll make me sick, it's not working. So firsthand, is it worth it?
Most
Yeah.
definitely.
It's worth it, just because whenever your body takes in something new, you're gonna have that mild reaction. So it's like if you're lactose intolerant or something, or your body's gonna have that reaction to it. But if you slowly get it adjusted to it, it's gonna start working out. Just like if you're going to the gym or something, your body's gonna be sore, but if you want those results, you're gonna want to keep going just to get better. So I definitely think it's worth it, just because you never know what you will come in contact with, as far as anything, whether it be sexual, needles, food, anything else. It can definitely help you a lot. So I think it's worth it.
All right, good as hell.
Yeah, most definitely. Like, people need to realize that we live in a world-class, you know, medical system. And it's like, we need to be thankful for that and take advantage of our resources and our options that we have in this matter, you know, to, like I said, stop the infection. So.
Stu, what you think?
It's definitely worth it. Like, I'm gonna use a very, you know, simple analogy, like, you know, Jonathan did. Like, he's asking, headache or HIV? Pick a poison, right? So if it's something that helps to prevent, you know, people getting sick or spreading anything of any kind, then, you know, if the resources is available, we should take advantage of it. Oops.
When you lose you there, you good?
Yep.
All right. I wish everybody thought like y'all.
That's what I'm saying. Like, in my sound, I don't know, don't take this the wrong way when I say it, but I guess we can almost say, in my eyes, at least, those individuals that, you know, have these, whatever you want to even call it, they're selfish in a way, in my eyes, because, I mean, it's putting everybody else at risk personally. But like I said, don't take that the wrong way.
Understood. And
May I chime in?
oh yeah, absolutely. Come on.
I want to make a short case for PrEP, you know, because I believe it's worth it. Analysis was done by Pennsylvania Department of Health, HIV and STD program, and to help decide at what point to begin PrEP intervention, you know, among STD patients who have had STD at least more than once. And STDs, I mean syphilis, gonorrhea, chlamydia, among others. So listen, here are the results. They analyze the patient's data retrospectively, and, you know, on how many months it took for them to be HIV positive. They found that individuals 15 to 24 years of age had a reported positive case of HIV an average of 5.84 months after diagnosis with a fourth STD. They also found that individuals greater than 25 years of age had a reported HIV case an average of 24.9 months after fourth STD infection. So really, my point here is prevention is better than cure. Make the best choice for you. Thank you.
All right. Numbers don't lie. Phil is coming with the numbers. All right, my last question for you, Dorian. And you guys can chime in if you want to. A lot of people think once they get PrEP, they're good. Does PrEP prevent other STDs or STIs?
So no, definitely if you're taking PrEP and you're concerned about coming in contact with someone who's HIV positive and your risk of acquiring HIV, if you're on PrEP and you're taking it consistently every day and adhering to the medication, it's 99% effective in preventing your chance. And there are some that say you have no chance of contracting HIV being on PrEP if you're taking it consistently. But we know that there are other STDs and PrEP does not protect against those. So you want to make sure you're adding those extra layers of protection. And what are those? Using condoms. We know that condoms are not 100%. We know that there's still skin-to-skin contact with condoms. So it does still put you at risk for getting infections such as syphilis, such as with herpes, genital warts. But they're better than using nothing at all. So I would say that's one extra layer of protection you want to add along with PrEP. Also, what are some other layers of protection? Those are definitely going to be, reducing your number of sexual partners. Of course, the more partners you have, the more it puts you at risk because you have a greater chance of running into someone who has an STD, such as gonorrhea, chlamydia, or syphilis. So if you have less partners or you're in a monogamous relationship, that's definitely going to reduce your risk of contracting other STDs aside from HIV. And then also, aside from that, is just knowing your partner's status, knowing if your partner is HIV positive, but also knowing when was your partner's last test, when were they last tested for STDs? And that's important to know also. And then just ensuring that when you're following up, if you are having multiple partners, ensuring that you are getting tested, especially if you're having unprotected sex, even though you're on PrEP, but if you're having unprotected sex or you have multiple partners, ensuring that you're following up frequently. And that would require you to get tested for those other STDs more frequently than every year. I know a lot of the practitioners, when we have PrEP patients come in, we try to obtain a really good sexual history over, from those previous 3 months. And if individuals have identified that they've had sex without condoms, they've had multiple partners since maybe their last appointment or last PrEP appointment, then we do try to make sure that we're doing that testing every 3 months as needed to ensure that they have not during that 3 months or since their last appointment acquired another STD such as gonorrhea and syphilis. So that usually entails us doing with oral sex. We'll do a culture for gonorrhea and chlamydia of the throat, doing an anal culture for individuals who are having sex and they're, practicing mostly about being a bottom and a top, and we offer that testing. So it's important also to use condoms for that reason if you're on PrEP. Like I said, just adding those extra layers of protection is important and ensures that you're staying healthy and you're not putting yourself at risk or putting your partners at risk or going undiagnosed with those infections.
Awesome. See, that's why I like talking to the experts. One last question. This is for everybody. If we was to post this on everybody's phone, a message pop up like Amber Alert on everybody's phone, and you had one message to leave with them about PrEP, what would you say? What would be your message to them?
Get your head out of your ass and get with the program.
All right, I get that. That'll get that. All right, Jamie.
I don't know. I would say, I don't know. It's something with love and just to love yourself and to love everyone around you to prevent it. It's just all about the protection.
Phyllis.
Be in control, protect yourself, get prepped.
Awesome. Dorian.
I would just say the most important thing is educate yourself. I'm a big advocate for educating yourself, not waiting for someone else to take the initiative. Yeah, if you're coming into the healthcare system, would you expect someone to ask you the questions and make sure that the right testing and the right medications and preventative options are available to you? Ideally, yes, I would love for that to happen. I'm a practitioner and I know I've seen that in my own practices, but that does not happen a lot of the time. So I would just say be proactive in your health and advocate for yourself as you educate yourself, then know go to a doctor's office or go to that provider and ask for what you want based on how you've educated yourself. And I think that's going to be very important. So educate yourself, advocate for your health, and most importantly, love yourself, and take the proper precautions to protect yourself.
Awesome. All right, last but not least, you.
Simple and easy. Protect yourself and each other. Get PrEP.
Perfect. All right, everybody knows you can contact Phyllis for anything and everything about PrEP. I want to thank everybody that tuned in, all the panelists. Thank you for giving us this hour. I hope it was well spent. You guys educated a lot of people. And if you guys need anything, of course, you guys know where we're at. But contact Phyllis, contact me. We're at the health department in GNR. And I appreciate your time, fellas and ladies. Thank you.
Thank you.
Thank you.
Thank
Have a
Thank you
great day.
all. Thank you,
y'all.
panelists. That was great.
Thanks, Phyllis.
you for sharing your time with us.
No problem. Thank you.